See, when you're talking about the vertebral landmarks, you will find this diagram. What is it? Side view of adult male. Side view of adult male. Adult male. Adult male, are you trying to talk about the larynx level? Yes. Okay. Vertebra level, C3, C6 vertebra. Yes, that's what. Okay, do it then. See, this is common carotid artery bifurcating into two branches. What is that? Common carotid artery bifurcating into two branches. Tell me where. Common carotid artery bifurcating into two branches. I think that is the superior border of the lamina of the thyroid cartilage of the larynx. Correct. Common carotid artery bifurcated in two branches at the superior border of the lamina of the thyroid cartilage of the larynx. Now this is the thyroid cartilage of the larynx, then this must be cricoid. Yeah, that is cricoid. Can you tell me what is the level of cricoid? You mean to say vertebra? Yes. I'll tell you, lower border of C6 vertebra, lower border of C6 vertebra. So cricoid cartilage is at the lower border of C6 vertebra. Then where is the larynx? Because this is larynx now, you are telling. Thyroid cartilage, cricoid cartilage, this is larynx in the adult male. Tell me what is the extent? Must be C6, C5, C4 and C3. Yes. Yes, this is the line. This is the line. So this is the line which is telling you extent of the larynx. Yes, C3, C6 vertebra in adult male. What about the female? Higher. And what about the child while swallowing? Still higher, can reach here. Who is this? This is C1 vertebra, atlas vertebra. So you're telling that in infant while swallowing, the larynx, this larynx, yes, can reach as high as C1 vertebra, atlas vertebra in an infant while swallowing. Yes, that is question already. Okay, fine. This is common carotid artery bifurcation. I think that is where I have carotid body, carotid sinus. Yes, carotid body, carotid sinus is here. You can do carotid sinus massage for sinus tachycardia or PSVT. What is PSVT? Paroxysmal supraventricular tachycardia, carotid sinus massage to reduce the heart rate. And there is a carotid body tumor. It is found here. Carotid body tumor, carotid sinus, carotid body here. Okay, what is this? This is the level where you have carotid body, carotid sinus. This is the level where the larynx is beginning. You mean to say C3 vertebra. Yes. Common carotid artery bifurcating into two. Yes. Okay. What is this level? This is larynx C3, C6. Okay, this is larynx C3, C6. So that is the C3, C6. Yes, that is the C3, C6, the extent of adult larynx. This is the cricoid cartilage, the lowermost cartilage of larynx. Yes, that is the cricoid cartilage, lowermost cartilage of larynx. And is at the lower border of C6 vertebra. Yes, it is at the lower border of C6 vertebra. Then I'll tell you one thing. What? This is the beginning of trachea. Yeah, of course, if the larynx stopped, the beginning of trachea is there. And that is also the beginning of the esophagus. You mean to say esophagus begin at the same level where the trachea is beginning? Yes. You mean to say larynx, pharynx will end at the same level? Yes. Larynx and pharynx will end at the same level, the level where the trachea and esophagus will begin. Where exactly? The lower border of C6 vertebra is the beginning of trachea, esophagus. Okay, you are telling this is the lower border of C6 vertebra. Yes, that is the landmark which you have to remember. And this is the diagram which will again take you there. You mean to say lower border of C6 vertebra again? Yes. Lower border of C6 vertebra again? Yes. Okay, what is happening at lower border of C6 vertebra again? You know, that is where you have the cricoid cartilage of the larynx. Yes. Lowermost cartilage of the larynx. Yeah, okay. That is where you have a sphincter named cricopharyngeal sphincter. So that is causing narrowing of the lumen of the esophagus, the narrowest lumen of esophagus at the beginning of the esophagus. Oh, 15 centimeter from upper incisor. Yes. That is the ending of larynx pharynx. Now, if this is the ending of larynx pharynx, that must be the beginning of trachea esophagus. Yes, that is ending of larynx pharynx and beginning of trachea esophagus. Can you tell me one thing? What is the length of trachea? Length of trachea is approximately 11 centimeter. So if you say length of trachea is approximately 11 centimeter, where is it bifurcating? Trachea bifurcation is a controversy. Yeah, controversy, fine, but where is it bifurcating? It is the disc between, where? T4, T5 vertebra. Disc between T4, 5 vertebra. Yes, T4 and T5 vertebra. What if the disc between T4, 5 not given? Then I'll say upper border of the, this is, I'll say upper border of the T5 vertebra. So you're telling that if the disc between T4, 5 is not given, then you will answer it as, if disc between T4, 5 is not given, then I will answer it as upper border of the T5 vertebra. This we'll discuss again in thorax region. But remember, if upper border of T5 vertebra is not given, then you should answer upper border of T6 vertebra, especially in deep inspiration. So what is the question? Question is, where is trachea bifurcating? Trachea is 11 centimeter. Where is it bifurcating? And your answer is disc between T4, 5. If not found, change your answer to upper border of T5. Not found, change your answer to upper border of T6, especially in deep inspiration. If not found, means that is also not there. No. Then they must be asking the cadaver. So what about cadaver? The patient is already dead. It is a cadaver now. Really? Yes. Then what is the answer in cadaver? Then the answer will be lower border of T4 vertebra in cadaver. So in cadaver it is T4 vertebra. Yes, cadaver T4 vertebra. Maybe lower border of T4 vertebra. So there are multiple answers. Yes. This we'll discuss in thorax again. At this moment, tell me, what is the length of the esophagus? Length of the esophagus, I think length of the esophagus is 25 centimeter. Yes, correct. Where is it beginning? Where is it beginning? Lower border of C6 vertebra. And where is it ending? It is becoming stomach. Yeah, it is becoming stomach, but where is it passing through diaphragm? Where is it passing through diaphragm? That is some diaphragmatic opening at T10 vertebra, and there was some narrowing, remember? So at the T10 vertebra there is a narrowing in the esophageal diaphragmatic opening of esophagus, and there is a anatomical sphincter also. So what do you want to know? What I want to do is draw a diagram for this same information and add more information. Like what? I want to discuss isthmus of thyroid gland again. Why? Because I want to put a tube into trachea. What is that? Tracheostomy tube. Why? Because I have a patient, that's why. Okay, let's do it. See, this is the discussion on the vertebral levels. Which vertebra? Lower border of C6 vertebra and disc between T4, 5 vertebra and the T10 vertebra. Okay. Then put a boundary line lower border of C6 vertebra. Why? Because that is where the two tubes are passing. These two tubes, gut tube and respiratory tube. What is gut tube, respiratory tube here? There is pharynx, in front of that is larynx. So first there is pharynx, in front of that is larynx, yes. And at the lower border of C6 vertebra, they will change into what? Esophagus and trachea. You mean to say, pharynx will become esophagus at the same level where the larynx will become trachea? Yes. Which is lower border of C6 vertebra? Yes, because pharynx, larynx end at C6 vertebra lower border. Esophagus, trachea begin at C6 vertebra lower border. Actually, there was a cartilage here. Which cartilage? Cricoid cartilage, having a sphincter here called as cricopharynx sphincter. Cricopharynx sphincter, cricopharyngeal sphincter, which is narrowing the lumen of the esophagus at the beginning of esophagus. narrowest lumen of esophagus. Yes, narrowest lumen of esophagus at the beginning of esophagus, which is 15 centimeter from upper incisor. So you're telling this is larynx. Yes. And this is the lowermost cartilage of larynx, the cricoid cartilage of larynx. Yes. At the lower part of C6 vertebra. Correct. Having a sphincter with pharynx, which is called cricopharynx sphincter. Yes. Because the cricopharynx sphincter, it is some narrowest lumen of esophagus at the beginning of esophagus itself. Here. Yes, here. And most of the foreign bodies are found here. Why most of the foreign bodies are found here? Who is swallowing the foreign bodies? The psychiatry patients and the children. So children and psychiatric patient will swallow foreign bodies. Yes. And then examiner is asking, you are putting a esophagoscope. What is the length of esophagoscope required? What I am doing, esophagoscope you are putting to remove the foreign body. What is the length of esophagoscope required? To remove the foreign body, because most of the foreign bodies are stuck here. Why? Because this is the narrowest lumen of the esophagus. If foreign body passes through that, it will pass out through the fecal matter after a few days. If foreign body could pass through that smallest lumen, it will pass out in fecal matter after a few days. So most of them are stuck here. Yes. Question is, a psychiatric patient or a child has swallowed a foreign body and it is stuck here. What is the length of esophagoscope required? Of course, it is 15 centimeter calculated from upper incisor then. And can you tell me what is the last narrowing at? Last narrowing, T10 vertebra. Yeah, T10 vertebra, but what is the marking? It is passing through diaphragm. Yes, it is passing through diaphragm. I know there's a diaphragmatic opening at the T10 vertebra, but what is the marking? You mean to say the centimeter? Yes, it is 40 centimeter. Calculated from upper incisor. So, at the T10 vertebra, the diaphragm has an opening for the passage of the esophagus and it is 40 centimeter from upper incisor. What is the length of esophagus? Length of esophagus, we can calculate. How? By 40 minus 15. What is 40 minus 15? It is approximately 25 centimeter. Then what is the length of trachea? Length of trachea, 11 centimeter. If you say length of trachea is 11 centimeter, where is it bifurcating? If you say length of trachea is 11 centimeter, then where is it bifurcating? Let us see where is it bifurcating. Actually, it is bifurcating at a disc between T4-5 vertebra. So, you are telling this is the 11 centimeter of trachea, which is bifurcating at the disc between T4-5 vertebra? Yes. When you say trachea is 11 centimeter length and bifurcating at the disc between, what if disc is not given? Then I will say upper border T5. And what if upper border T5 not given? Then I say upper border T6. And what if upper border T6 not given? Then I'll say lower border T4. Lower border T4. Cadaver. Yes, cadaver, tracheal bifurcation. Be careful. All the questions are there. With different choices, yes, and every time the answer changes, yes. Practice MCQs. I have only one advice to my students. Practice as many MCQs as possible. Then you get the insight. You learn the psychology of the examiner, and when you learn the psychology of the examiner, then you beat him at his own psychology. That's what we do. How do I beat examiner at his own psychology? You cannot interview the examiner. You cannot learn his psychology by interviewing because they are behind the screen. So how do I interview them? By practicing their methods. And what is their method? Practice MCQs. That is their methods. As you learn their method, you can beat them at their own method. Sir, what is happening? What are you talking about? I'm talking about read the questions where the tracheal bifurcation is asked. There are some 5-6 questions and each answer will be different. You have to learn why this answer is being given. We'll discuss it again in thorax. So what are we doing right now? Right now you have to tell there are 16 to 20 C shape rings in the trachea. Which ring will you cut to put a tube into trachea, tracheostomy tube? So there are 16 to 20 C-shape ring in the trachea. Which rings will you cut to put a tube into trachea, which is called tracheostomy tube? So there are 16 to 20 tracheal rings. Yes, tell me which ring are you cutting? I'll cut the ring number 2, 3. But before you cut the ring number 2, 3 to put a tube into trachea, you would have already cut the isthmus of the thyroid gland. So tell me, where is the isthmus of the thyroid gland is lying? Because first you cut the isthmus of thyroid gland, then you cut the ring number 2, 3 and put a tube into trachea for tracheostomy operation. Then obviously the answer is isthmus of thyroid gland is lying in front of ring number 2, 3. No. You know what is written in Gray's Anatomy? It is written 2, 3, 4 ring. So Gray's 41st? Yes, 41st, the latest edition. One question came, where is the isthmus of thyroid gland? Answer was ring number 2, 3, 4. Next question came, the answer was ring number 2, 3. Next question came, the answer was only 3. So you want to say, examiner, keep playing with the information. Yes, it depends which kind of choices are there. Remember, somebody asking where is the isthmus of thyroid gland, you should answer it is in front of ring number 2, 3, 4. If not found, then say it is in front of ring number 2, 3. If not found, then say it is in front of ring number 3. More precisely, the middle value. But the first answer should be Gray's Anatomy. Can we see such questions? Yeah, I'll show you one such question, but at this moment, do you remember? Where is the common carotid artery bifurcating? Common carotid artery. It was bifurcating here. Where is it bifurcating? This is common carotid artery is bifurcating here. What is this? It is a superior border of the lamina of the thyroid cartilage of the larynx. Okay, so this is common carotid artery and it is bifurcating now. And when the common carotid artery is bifurcating into 2 branches, it is the superior border of the lamina of the thyroid cartilage of the larynx. So superior border of the lamina of the thyroid cartilage of the larynx. Why do you want to know? Because that is where I found a tumor. What tumor? The carotid body tumor. And that is where I will do the massage. What massage? Carotid sinus massage. Why are you doing carotid sinus massage? To take care of that PSVT case. PSVT, paroxysmal supraventricular tachycardia. Reduce the heart rate till my friend is injecting something into the patient. Who is your friend? Nurse. Nurse is injecting. I have written the prescription. Now the nurse is injecting. Oh, nurse is your friend. Yeah, I am in emergency. In emergency, nobody is there. Everybody sleeps in the night. So why are you not sleeping? Somebody has to be in the emergency. This used to happen in Bangalore Medical College, you know, when we were doing internship. All the emergencies, this man will take care of. Why? Where are others? Anyway, so we learn a lot of things in emergencies, you know. You become a doctor during internship. Don't miss your internship, especially emergency. Sir, I want to have a PG seat. You want to have a PG seat without becoming a proper doctor? Don't miss your internship. Don't miss your emergency. Because that will make you the real doctor when nobody is around and you are the sole there and only one friend around, which is the nurse, you know. We used to have very old trained nurses in emergency. Emergency, there will always be old trained nurses, never the young nurses. Do you know that? 55 years, 60 years, 65 years, and they'll help you. You know nothing and they know everything because they have watched people like you for 50 years. So that is a good friend there, you know. Anyway, that is the one. I am just sharing one experience, that's all. Okay, so this is one X-ray you have taken. Yes, for the child or the psychiatric patient. Yeah, actually, this is the foreign body. So where is the foreign body then? What is the length of the esophagoscope required? That we told 15 centimeter. Calculated from upper incisor. That is where most of foreign bodies are there. Okay then, fine. what is this? This is about the various levels, you know, the hyoid bone and the thyroid cartilage and cricoid cartilage and trachea, and what we want to know is where is the isthmus of thyroid gland. Isthmus of thyroid gland, but you already told. No, tell me again, because I want to put a tube into trachea now. I think isthmus of thyroid gland is in front of ring number 2, 3, 4. Yes. If not given, 2, 3. Yes. See here. Bailey loves surgery and cutting the ring number 2, 3. So this is Bailey loves surgery, cutting ring number 2, 3. Yes, to put a tube into trachea, tracheostomy operation. But before that, you would have already cut the isthmus of thyroid gland. Then you cut the ring number 2, 3. This is a diagram from Bailey and Love surgery. Okay, if you say so. 2 and 3. Yes, fine. What about this question then on trachea? What question? You know, a question has come. Where is the carina of the trachea? What is carina? Bifurcation, there is a carina. So first of all, it is 11 centimeter and extent. Lower part of C6 vertebra and lower part of T4 if it was cadaver. And what if it is adult, normal adult situation, living subject? Disc between T4, 5. T4 is cadaver. Okay. What else you want to have information regarding carina? What about carina? Carina is actually here at the tracheal bifurcation. Yes. What is the angle between left, right principal bronchus? 70 degree is a question. So angle between right principal bronchus, left principal bronchus is 70 degree. Yes, is a question. And this is the bifurcation. There you have the carina. Now, some books will say carina is T4 level. Some will say just between T4, 5. Some will say upper part of T5. Some will say upper part of T6. That is a controversy. So we'll discuss it again in the thorax. I'm telling you again and again. Okay. So we wait. Yes, you wait. But here you answer the question. Isthmus of thyroid? Yes. I think we should follow Gray's Anatomy first. Yes. So this is the answer. Yes, that is the answer. What if it is not found? Then I can take 2, 3. And what if it is that is also not found? Then I'll say 3. Why? What kind of question was there? Actually, they're asking where is the isthmus of thyroid gland, and choices were ring number 1, ring number 2, ring number 3, or ring number 4. See, what is the extent till that the examiner can go? He's asking where is the isthmus of thyroid gland, and the choices given are ring number 1, ring number 2, ring number 3, ring number 4. Now what did you answer? In such a situation, you cannot have a triple answer. You can have only one answer, and your answer was this. The middle value, the middle value. So be careful. 2, 3, 4 is good. If not found, 2, 3 is good. If not found, 3 is the answer. Okay. Here I will keep this answer. Yes, of course.